Welcome back. Our last guest today is Lifestyle GP Dr. Avi Charlton, and we will be talking about the health benefits of functional breathing. Welcome back.
Thank you for having me again, Stephanie.
Dr. Avi, what is functional breathing and what are the health benefits of it?
To understand functional breathing, we've got to understand dysfunctional breathing. Dysfunctional breathing means not breathing properly. What happens is if we don't breathe properly, we can get more anxious. We suffer from palpitations. And if we use our mouth to breathe a lot, then we yawn a lot and we feel like we need to take big breaths all the time. We feel like we're not getting enough air. We feel short of breath. What happens when people don't breathe properly is they might not sleep properly as well. Sometimes some people snore and then they use their mouth for breathing rather than the nose for breathing. Then they don't sleep well. They wake up not having enough energy and it becomes a vicious cycle. Then they don't breathe well during the day. They feel like they're short of breath. They feel anxious and they don't have enough energy to perform in the day-to-day activities. There's signs that can tell you that if you're not breathing properly, you might yawn, you might feel short of breath, and you feel like you're gasping for air. Sometimes you get palpitations or even reflux.
How can our viewers use breathing to improve their health?
So there's a few little things and then there's a few breathing exercises that we can do. What we can do is we can practice breathing light, breathing slow, and breathing deep. So I'll elaborate each tip. Breathing light means we don't take big, huge breaths all the time, and practicing breathing less amplitude breathing, light breathing. What that can do is that can tell your body to hold more carbon dioxide, and there's a little bit of science to it that it actually tells your oxygen to get into your body, the brain, the muscles more. So light breathing improves our carbon dioxide tolerance. Deep breathing means we practice breathing into the diaphragm. What we can do is we can practice getting our hands to feel our rib cage. If we breathe into our rib cage, our ribs will come out and then our belly will go out. As we breathe out, our rib cage will go in and our belly will go in. So we practice deep breathing into our diaphragm as feeling our rib cage go out. So there's breathing light, breathing deep, and breathing slow. So what we can do is we can practice slowing down our breathing. We can do breathing exercises that involve slowing down. If you're new to this, you can do counts, breathing in for 3 and out for 3, breathing exercises. Then if you get better at it, you can breathe in for 4, out for 4, or even in for 5 and building up to as long as you can, as you tolerate on breathing exercises. Then there's breath holding exercises that you can slowly incorporate into your life. There's a technique called box breathing. Box breathing means that you take a breath in for 4 counts and then hold for 4 counts and then out for 4 counts and then hold again for 4 counts. And then if you can do 4 counts, you can increase it to 5 counts or even 6 counts. This technique is used by the Navy SEALs to slow down their anxiety, calm them down, and that can improve their mental health. That helps to improve our breathing and reduce anxiety, improve our well-being as well. Then there's lots of other breath holding exercises that we can practice. Let's say you're going out for a walk, you can do some breath holding. If you're new at it, you can hold, pinching your nose for 10 steps, and then you can release and walk 10 steps. Then you can repeat it again 5 or 6 times, doing breath holding exercises. As you get better, you can increase it to 15 steps or even 20 steps. Then that helps to tell our body that we can hold on to carbon dioxide more. Then your body can learn to tolerate higher carbon dioxides. That actually gets your body, your muscles, and your brain to have more oxygen delivered. That in turn improve your mental health, improve cognition, and you function better. The more we breathe through your nose, the more you breathe through your nose at night when you're sleeping as well. We also talk about using mouth tape to tape your mouth so you don't breathe through your mouth at night, especially for those who don't know if you're breathing through your mouth at night. And some people worry about that they will suffocate if they're breathing through, if they have their mouth taped. There are lots of different mouth tapes. Some of them have a little slit that doesn't cover their mouth, and that might help you to get used to a mouth tape and practice breathing more nose breathing. In turn, that can help with better sleep and better function during the day. With children, what happens if the children breathing through their mouth is they can get facial development problems. If they breathe through their mouth too much, the jaw development isn't quite right, and they can get facial development problems, receding jaws, and they're more likely to need orthodontic treatment, braces. So what parents can do is they can remind their children to breathe through their nose more often, all the time, and even at night they can mouth tape the kids. They might have to get used to it, and you can get special mouth tapes that has a slit in the middle. And there are exercises called buteyko exercises that their mothers can do games with the children, practice more nose breathing and even breath holding. What I suggest is people can seek help with professionals who are trained in breath work and breathing exercises, who talk about how to breathe functionally. So we can get the right guidance to talk about functional breathing, get the right exercises for breath work. In that way, you can get the right advice on how to breathe properly.
Great. I'm going to be checking my breath for the rest of the day.
That's great.
Thank you for that information.
Thank you, Stephanie.
If you would like to know more about functional breathing and Dr. Avi Charlton, please visit her webpage on our website, healthwellbeingandlifestyle.com.au. That's all we have time for today. Goodbye until next week.